My goal is to bring you interesting guests that have a important perspective. And first of all, a shout out to my business partner, Dr. Ken Chang, for giving me this idea to interview this guest, Professor John Lott. So I've known about Professor John Lott for many years. I read his book years ago, More Guns, Less Crime. Professor Lott is an American economist, a political commentator, and a Second Amendment advocate. Professor Lott was formerly employed at the University of Chicago, Yale University, the Wharton School at the University of Pennsylvania, and he earned his PhD in economics from UCLA. He is the president of the nonprofit Crime Prevention Research Center. Crime Prevention Research Center. When we're done, I'll post a link in the comments so you can go to that center and see what Dr. Lott does, and if you're willing to contribute to his efforts, because I think his voice is much needed in this fight and with all that's going on in the world today. So Professor Lott, thank you so much. It's a privilege to have you on, and I hope our audience will enjoy your perspective on many of these things.
Well, thanks for having me on. Just have one little comment, and that is, when you introduced me, it sounds like you're reading from Wikipedia. I would just say that I don't think of myself as a Second Amendment advocate. It's not how I got involved in this debate. I'm a researcher, and I try to figure out what types of things make people safer. And I think you have academics on the other side of the debate. They don't go and put down that they're a gun control advocate. They refer to them as researchers most of the time. And
Absolutely. And I plead guilty. I did what was easiest, and I looked on Wikipedia when I Googled you to get a little bio. Right. And I know, unfortunately, you too often get typecast as a Second Amendment guy. What people forget is that you were first and foremost an economist and an academic. And so it's really with that information that I'm interested in speaking to you. Because we've got, at least currently in this nation, one of the craziest civil rights infringements that I've seen, as businesses and personal space is literally being shut down. What's your perspective and what's our path forward?
Okay, well, if you're asking me as an economist, I guess I would limit the shutdown. You're a doctor, but I would say I would try to limit the shutdown to those people who are particularly vulnerable, people who have pre-existing conditions, the elderly. I look at the data. I wish I could get even more detailed data, but I look at the data for Europe and for parts of the United States. You have someplace between about 96 and 99% of the deaths are for people that have pre-existing conditions, and the remaining 4 to 1% basically seem to be people who are relatively old. And so, that's a fairly well-defined group of people. Now, the issue that I wish I had better data for is exactly what is meant by a pre-existing condition. So, obviously they have things like diabetes, but when you come to things like hypertension, what level of hypertension is like anything? The best I can guess from looking at the numbers is that it has to be a relatively significant level of hypertension before people are in danger.
Well, it seems to me the issue isn't do you have an illness, it's is your illness being well managed. So if you're a diabetic but your blood sugars are under control, if you're a hypertensive but you're on medication and your blood pressure is normal, etc., then I'm not sure that in and of itself puts you at higher risk. I know in Italy, for example, the average age of death there was about 82 years old. Right. And although the media loves to highlight if somebody less than 50 in a bad influenza season, we'll see about 25% of the deaths from influenza in people that are younger than 65 years old. But you never see headlines when an influenza death occurs in a younger person. You're only seeing that now as it relates to this current virus.
Right. I agree with everything you just said. So, obviously there are big costs to having the economy being shut down. You have stress, people losing their jobs, just being cooped up, people being afraid to go to the doctors, if they have issues that may be occurring. And so, you know, if it were me, I would try to put aside those people who are most vulnerable and try to open things up as much as I can for everybody else.
Yeah, absolutely. There's an article I live in Orange County in Southern California. Of course, you're, I believe, in Pennsylvania. Is that right?
But yeah, our organization's been based there. That's right.
Okay. And in today's Orange County Register, there's an article about the dramatic increases to calls to suicide hotlines here locally. And I read an article, I think it was from Michigan, where it said on a typical month, they might get 1,000 calls to a mental health center. And now they're getting 250,000 calls to that same center.
Right.
So the UN put out a piece a few days ago that said they expect to see somewhere between 100 and 200,000 deaths in children as a result of the poverty caused in third world countries.
Yeah, no. I mean, income is very closely related to life expectancy. So I just think one of the problems that I think's occurred has been there's been too much focus on just this one dimension of death, and that it's one of the things President Trump has been trying to emphasize a lot. And I've dealt a lot with public health people in terms of the gun control debate. I've always been a little bit kind of skeptical about their statistical capabilities in that debate. And I see a lot of the same issues that I've seen in that debate kind of play out in terms of the estimates that we've seen here in terms of expected deaths from the pandemic. And
speaking of the gun control issue, I'd be remiss not to ask you. I read this morning and I heard last night about this shooting up in Canada where a bunch of people died. And as I was reading the article this morning, of course, I was waiting for the knee-jerk reaction from the left to call for more restrictions and so forth. And somewhere around paragraph 5, I read that Canada has some of the strictest gun laws in North America. So any thoughts on what happened in Canada?
Right. Well, we're still finding out stuff. It seems like there was some domestic issue that was there, an ex-wife. The guy went over, murdered her, killed their 2 kids that were there. He then killed a neighbor, and then he killed an officer, basically took the officer's uniform and stuff, went around, stopped some cars, and killed people. Seemed like kind of a serial murder type of case rather than what you'd call a typical mass public shooting.
Right.
One of the things that was interesting to me was what was not in the news stories. And that was what types of weapons were used, particularly initially. It's not clear that a gun was used in the initial killings that were there. My own guess is that if it had been, they just passed some new gun control laws in Canada. If it had been any of the ones that were outlawed or whatever, that would have been, like an AK or an AR, that would have been the lead headline in the news. And the fact that it wasn't there, I guess, told me a lot. I
think the media is also just distracted by what's going on with this virus, and they can only handle, one headline fear-mongering piece at a time.
I don't know. That's probably asking too much of them not to pass up other opportunities to do things. But it's just, my guess is the guy probably had a shotgun because handguns are very rare there. He killed the officer. I guess he took her handgun that was there. I'm not sure when you say one of the most restrictive in North America, you basically have Canada, the United States, and Mexico. Mexico has incredibly strict gun control laws. Since 1972, there's only been one gun store in the country. It's run by the Mexican military out of Mexico City.
I guess the cartels didn't get the message.
Yeah, well, Mexico has a murder rate that's about 6 times higher, at least, than what we have here in the United States.
Well, how is that possible with such strict gun laws? I thought that doesn't work that way.
Right. Yeah, I don't know. I guess the criminals have missed out on that. Look, they have a lot of drug gang violence there, and it's hard to stop the gangs from getting weapons to protect their drugs as it is to stop them from getting drugs. What people don't appreciate in the United States is how much of our violent crime is drug gang related. I mean, you look across the United States, over half the murders in the United States take place in just 2% of the counties. It's about 60 of the counties. And if you ever look at a murder map for those counties, you're going to see that about 2/3 of the murders in those places take place in about 10 block areas within those 2% of the county. So the murders in the United States are very heavily concentrated, and they're very heavily drug gang related. If I could click my fingers and cause all illegal drugs to disappear from the United States and all guns, how long do you think it would be before illegal drugs started coming back into the United States? If
We'd,
we're in El Paso,
we'd look like Mexico.
right, exactly. And the thing is, most people don't appreciate that a major source of illegal guns are drug dealers. Drug dealers have the weapons because they have extremely valuable property to protect. It's not like a drug dealer can go to the police and say, look, this other dealer stole my drugs. Can you help us get them back? They have to essentially set up their own little militaries in order to protect that.
Right.
When I testified before the Mexican Federal Senate and House Constitution Committees a few years ago, and when I was there, I got to talk to prosecutors and others. Over like a previous 5-year period, they had collected like 15,000 grenades from the drug gangs. They overwhelmingly get things like machine guns. They're not getting those from gun stores in the United States. They're bringing them in from around the world there. If we really want to go and reduce the murder rate in Mexico, one thing to do, if you legalize drugs in the United States, that would have a huge impact on drug gang activity in Mexico. Now, I'm not going to go and argue that's nirvana. You go and you legalize drugs, you're going to have more drug use. You're going to have more addiction and more other problems. But maybe some of the money that's being used right now in order to go and fight drug gangs could be used to go and help out people with those other types of problems that would be there. I'm just telling people what the trade-offs are. And people have to judge for themselves whether they think it's worthwhile. But
speaking of drugs and guns, I don't like to necessarily assume motives of politicians that are making these decisions. But here in Southern California, of course, the pot dispensaries have been deemed essential businesses,
right.
And the liquor stores, of course, are essential. But our gun shops and ranges have been closed down, and of course, we're not allowed to go to church, even if it's a drive-in church. So here we have our First Amendment and Second Amendment rights being stepped on. But essential so-called services like pot and alcohol, not to mention that elective abortions are still being allowed while other elective surgeries are being prohibited. Any thoughts on that?
A lot of it's arbitrary stuff that's going on. I mean, you look at a state like Michigan, for example. You have, you can buy pot, but you can't buy seeds to go and plant tomato plants and things like that. You can go kayaking, but you can't go in a small motorboat. Who knows how they exactly decided to go and do a lot of the rules that they have. As far as gun stores go, you go and look around. A lot of police departments have had very strong limits on their staff. Detroit has had something like over 20% of their police are either ill or in quarantine. You have a huge number of police departments around the country which are simply not responding to anything other than the most violent type of crimes. So you're a civilian there. You can't depend upon the police to go and respond. Hopefully there's no problem that's there. But it's understandable that just as people go and buy fire extinguishers because something may happen, they are more likely to go and want to buy a gun now, even many people who may not have previously thought of owning a gun.
Exactly.
Just because of the possibility about something that might happen. And, if these governors in California, he's basically left it up to local governments that are there. Michigan is similar. If they don't think that they can go and protect people all the time, which they can't do all the time, even under the best of circumstances, then the question is, why not let people be able to go and defend themselves? If my research convinces me of anything, it's basically the most vulnerable people in our society who benefit the most from owning guns. You have two groups of people. You have those who are most likely victims of violent crime. That overwhelmingly tends to be poor blacks who live in high crime urban areas. And the other group of people are relatively weaker physically, women and the elderly. You're almost always talking about a young male doing the attack. And when a man is attacking a woman, there's a larger strength difference that exists there than when a man is attacking another man. And the presence of a gun represents a much bigger relative change in a woman's ability to go and protect herself than it does for a man that's there. And so, my concern is that a lot of gun control laws in general make it so that the most vulnerable people in our society are not able to go and protect themselves. And, I hope, it's not like we have a zombie apocalypse that's hitting right now, but still people have reasonable concerns. What happens if shortages arise? What happens if police become even more impaired? And we're releasing huge, in California, you've been releasing huge percentages of prisoners. San Francisco, I think they've released almost half the prisoners that are there. Los Angeles, I don't know the most recent numbers, but I'm pretty sure it was well over 20% of the jail population, probably well over that by now, has been released. It's not hard to find cases where some of those people have been released, have gone out and committed murders or robberies or other types of crimes. So it's, you try to do things like give police masks or gloves, but in the rough and tumble of arresting somebody, that mask may not stay in place. And so you have concerns about the safety of police. So you have police departments in California, as well as the rest of the country, are limiting police going out on calls simply because they want to limit the exposure that the police have. They're also limiting the arrests that the police make because they're worried about introducing new people to the prison population. And, because you have new people that may have the coronavirus that's there. And so there are lots of issues that are there and lots of reasons for people to be legitimately concerned.
And so to get a little personal, what are you doing to keep yourself safe? And are you allowed out of your house and to the stores and so forth? What's going on in your life?
Well, kind of just stocked up on food. I think I'm pretty well taken care of here. Hunkering down with a friend. And they have pretty much, taken care of a lot of things. So I'm kind of free riding right now.
And President Trump has put together this Open Up America task force, if you will. Has the phone rang yet? Have they invited you to be part of that?
No, I haven't been asked. If people go to our website within the last week, I put together what I thought was a pretty powerful, interesting graph that was showing how the per capita death rates have varied over time in the United States versus other Western European countries.
Yeah.
What you find is that the United States has done extremely well. Would it be better if we had 0 deaths rather than 40,000? Sure. I mean, there's no doubt about that. But you have to adjust for population. And
that's crimepreventionresearchcenter.org, is that correct?
Crimeresearch.org.
Crimeresearch.org.
Right.
And that study and that information is there.
Right.
And are you on Twitter as well?
I am.
And
John R. Lott Jr., just my name. John R. Lott Jr.
Okay, very good. And so I'm going to look real quick on Facebook to see if anybody has asked some questions for you. And it's a great privilege for me to have you on. And let's see. There's Dr. Chang. And I don't know. I can't find it. I don't want to waste your time. So in the last few minutes, you've been with us now for about 20 minutes, and I greatly appreciate your time and your effort. And I hope your voice is out there in the media and that there's other personalities that are calling to interview you, because I think you have some wonderful information. And any last words that you want to share with our audience?
Well, I mean, I understand the concerns that people have. I have concerns both in terms of safety and in being an economist in terms of the economy. I think, I guess I've been kind of disappointed that the Democrats have been holding up some of the proposals that are there and trying to go and load up things with lots of pork and things like that, which, I understand their desire to go and create transfers or make changes for their constituents, but it comes at a real cost. If I was dictator right now, I suppose one of the things I would do is I'd have a big corporate income tax cut. But my guess is politically that's a complete no-go with Democrats controlling the House, which is too bad.
I did hear Art Laffer today recommend that there should be a temporary complete cut of the payroll tax to encourage workers to go back to work, and the payroll tax should include the employer part of that as well, to encourage employees to quickly hire the workers back. That seemed to make a lot of sense for me. Rather than paying people to stay home, once we open up the economy, incentivize and encourage people to go back to work.
Yeah, no, those are good proposals. I mean, one of the problems that you have with the stimulus that was passed before was that there's a fairly good section of the population that actually get paid more for being unemployed, for getting unemployment insurance than they do working. That's not the right incentive that you have there. And I mean, I have a small organization. I have employees who I believe would get more if I let them go. I haven't let anybody go right now, though obviously budget and stuff is pretty tight. But they've done lots of things there, so it's kind of you don't even need to be fired anymore in order to get unemployment insurance. It's kind of depending upon the individual's self-evaluation that's there. A lot of the safeguards that you normally have in the program have been gutted and removed.
Yeah,
and it creates the wrong incentives for people. And I'm a little bit concerned that there's some governors that seem to want to go and keep things shut down longer than they need to and more extreme than they need to. Yeah, a lot of these rules are statewide, and you have huge variances across the states. I mean, you may have some urban areas where things may be, relatively higher infection rates, but every state has rural areas and urban areas. And so just because you have a rule that may make sense in a big city doesn't mean that that same rule makes sense in more rural parts of the state.
Yeah, absolutely. Even here in Orange County, where we learned from an interview I did on Friday that Hoag Hospital has over 250 ventilators at the standby and currently only has 2 patients on a ventilator. So it's pretty much ghost town at Hoag Hospital and many other local hospitals. So we don't see a lot of virus, and certainly our healthcare system isn't overwhelmed. So it makes no sense for Orange County to be treated similar as San Francisco or other areas that are more impacted. So there's been local protests and people march into city halls asking for the various officials to open back up. And it's so interesting to me that the same people that are committing economic suicide on the working person are the same ones that are continue to get government taxpayer guaranteed income and benefits. So they're not hurting, but they're imposing their will on the rest of us.
Yeah. Look, I mean, I don't understand why we need to have the benefits going to people who are working for the government. It's not like they're losing their jobs. You want to target the benefits that are being given out to those that are being affected by the changes that are here. But
absolutely.
You were mentioning ventilators. One comment that I would make is, the way the media has played this is it makes it sound like we've been near a disaster moment with the ventilators. As far as I know, nobody who's needed a ventilator hasn't been able to go and get it.
That's right.
To me, that seems pretty amazing. I mean, particularly given all the, excuse the term, hyperventilation that we've had. with regard to concerns about whether or not there would be enough ventilators for people.
Right. The biggest hyperventilator has been the governor of New York, Andrew Cuomo, who was hypercritical of the administration for not providing enough ventilators, and it turns out he didn't need very many ventilators.
Well, it turns out he was putting them in storage, the ones that
That's right.
Can
And
you
the Army
imagine
Corps of
in a
Engineers built space for more patients. We had the hospital, the Navy ship pull up near New York, and both of those were ghost towns, and they weren't even needed.
Right. No, I mean, I think there's an incentive both in the media and many politicians to go and scream disaster that's there. They get attention. Politicians and the media thrive on, clicks and people being drawn in there. It's interesting just to compare Trump, who's been relatively laid back. Obviously he's expressed concern, but he's had a calm, I think, generally, type of approach to this, and tried to be optimistic about what the future is going to be. And so, but anyway, we'll have to see. I just hope that and I've done some research a little bit earlier. I looked at infection rates around the world by looking at latitudes. And basically, because people say, well, you have to wait till the summer to go and see whether or not this is seasonal or not. Well, it's summer in parts of the world. And you can go and see, is there some type of systematic differences based upon whether you're in the southern hemisphere after you try to control for different policies and what have you in different places. And there seems to be a significant difference. The places where it's been summer have had much lower death rates from the coronavirus than places that are in the northern hemisphere. And hopefully that's good news, because if it is seasonal, it's going to provide some breathing space here for other things to go and be developed. I just hope that some of the reductions in regulations, one of the big things that Trump has done, which I think would have been very different from the reactions of many of his political opponents, was he reduced a lot of the regulations on setting up testing. He made it so that off-use, label use of drugs could be more readily used.
Right.
You contrast that with some of the governors in Michigan or Nevada, who threatened to take away doctors' licenses if they used off-label use of some of the drugs that were there.
Right.
And it's just a very different mindset about letting doctors and others being able to go and use their best judgment in things, rather than having to have some public official micromanage how they do things.
Yeah, absolutely. So, Professor Lott, I'll let you go. Thank you so much. I appreciate it. Crime Prevention Research Center. I encourage all my viewers to go there and check it out. Make a donation.
Crimeresearch.org.
Crimeresearch.org. Thank you so much for your time. Next time you're in Southern California, Dr. Chang and I will owe you a lunch.
I'll take you up on that.
All right, you take care. Okay, we're back. That was fantastic, wasn't it? Oh my gosh, what an honor to be with Professor Lott. Again, a shout out to my partner, Dr. Ken Chang, for making arrangements for that. That was super cool. A couple last things I want to share with you that I